So to provide some context, I want to begin with a brief overview of our NICU.
Not working. Oh, there we go.
Okay, and why family communication is such an important focus of our work. Our unit is a 50-bed level 3 NICU that cares for a large and medically complex population. Our care team includes 7 neonatologists, 14 neonatal nurse specialists, practitioners, and nearly 200 registered nurses, along with a broad interdisciplinary team. While this depth of expertise is a strength, it also means that families interact with many different providers throughout their baby stay. Each year, we admit about 600 babies. 20% of these babies weigh less than 1,500 grams, and our average length of stay is 24 days. Many families are with us not just for days, but for weeks or even months. During that time, infants often require complex care, frequent changes in treatment plans, and high-stakes decision-making. For families, the NICU is an unfamiliar environment, just like what you have heard earlier, where they are navigating fear, uncertainty, and complex medical information under significant emotional stress. Without consistent and intentional communication, families can feel overwhelmed, excluded, or unsure about their baby's plan of care. Given our unit size, acuity, and length of stay, reliable family communication isn't just helpful, it is really essential. These realities are what drove our need for targeted interventions focused on improving how we communicate with families. So to address these communication challenges, we implemented 6 targeted interventions in our NICU, each focusing on a different aspect of the family experience. Brandalyn will share about the love looks, All About Me and Shine Bright. And then Kelsie will talk about the neighborhood nursing. And then Sheree will review the leader rounding. I'll talk about the family provided communication that we started at the beginning of this divine initiative.
So at the beginning of 2025, we have a parent family experience committee where we were presented with key questions from the parent family experience survey about how we could strengthen human connection and improve human understanding. As a community, we wanted to identify meaningful ways to raise that challenge, particularly in areas where emotional connection matters most. Throughout our discussions, we recognize that families with infants in the NICU experience prolonged periods of separation and emotional strain. Many of the families have infants who remain hospitalized weeks and months, as we all know, after birth. And during this time, parents often go back to work, and the daily life responsibilities continue even with the babies in the NICU and having uncertainty. So this reflection led us to creating what we called love notes. The love notes were nurse-led intervention designed to deepen that emotional connection between families and their infants. The idea was to leverage the unique role of the nurses play as they spend a majority of their time at the bedside providing care, comfort, and observation. So through these love notes, the registered nurse could write little notes from the babies to the parents of milestones, achievements, meaningful moments, things of that nature. Like, I took my first bottle today, or I was so brave through my procedure. And those notes helped acknowledge and affirm parents and recognizing care and love and the effort that they also provide their infants. So, like, you're doing a good job today, Mom, from the nurse and the baby throughout the day. They're all kept in the neighborhood so that the nurses can grab them, put them at bedside for parents. So this is really practicing relationship-centered care by focusing on the family as an integral part of the care team and honoring their unique circumstances. So even though this is just it's powerful. It strengthens trust and communication and emotional connection between families and nurses. Secondly, PFX committee also wanted to put out the All About Me posters, so that this was a tool developed by nurses to give parents a structured way to share their infants' unique preferences and strengths. So you can see up there that it's designed for them to highlight their babies beyond their medical diagnosis. It allows families to comfort and families' involvement in a meaningful way. And this helps the entire care team see the baby as a person. So having the sign at the bedside always shifts the focus from the illness back to normalization of development and progression, even in the medically complex infants. So this All About Me poster improves communication between the families and the relationship towards staff. So when the families feel seen and heard, we understood that the overall stress and the family dynamic is reduced. And in addition, this tool helps staff recognize triggers or preferences early, preventing other things that could trigger or elicit anxiety or fear. So, well, lastly, we have our Shine Bright initiative, and this is where we talk about bedside shift reports. We really wanted to bring this forward to improve communication between the staff and the parents. So when the ongoing shift is coming on and the outgoing shift, we really want to recognize that the parents are there, that there should be some communication between the nurses and the parents so that they could come up for a plan of care for that day. It creates a space for the parents to feel included and a valued part of the team. So we really encourage our nurses to go in, have that conversation together so that the plan of care is clear for the day. And this helps strengthen the partnership between parents, and it supports relationship-centered, family-focused care in NICUs everywhere. So.
Oh, do you want to talk about your chart real quick?
So this is just, sorry, these are just some slides that shows improvement in our communication. We started in January of 2025. At that time is when the human understanding question was introduced. They put it on the survey, and then we saw a great improvement from July to December of that human understanding score. The overall communication with all of these initiatives greatly impacted our patient and family experience scores. So we were really proud that it did make a difference in these family stays.
All right. Well, we are also excited to present a nurse-led project that was started in our NICU. It has led to great improvement in our communication and ultimately that continuity of care for our sweet babies and their families. So our NICU has been a primary nurse model for as long as I can remember. I won't tell you how long that is. Families frequently express frustration with not receiving their primaries. And so we were just trying to figure out what is a better way? How can we provide better continuity of care with our nurses and the patients and families? The reason our families didn't always get their primaries, it could be a different thing. Some of our nurses work 2 days a week. Some of them work 3, some of them work 1. And this led to big gaps where even a couple of their primaries weren't there. One of our primaries could be providing orientation for another nurse on another hallway. It could have been vacations, sick calls, all of those things that led to the primary system just kind of breaking down. Nurses would also report frequent frustration with the primary model, especially if that patient's stay was significantly long. Sometimes that led to some burnout. We saw that often those high acuity, really interesting cases were signed up for very quickly. But those more complex families, those more difficult social situations, no one would sign up for these babies. And so it often led to nursing leaders having to kind of seek out RNs and asking them, can you please sign up as a primary? This baby deserves a primary as well. The impact of these dynamics led to inconsistent care experiences, increased family complaints, and a high strain on nursing staff and leadership. So it highlighted a need for a better approach. But no worries, a plan was in place to help improve these experiences for families. A new model emerged, a team of fantastic nurses, bedside nurses, and charge nurses led by our own Sheree Dark, went exploring for a different alternative, a better model. During a literature review, they identified the neighborhood nursing model as a promising alternative. Our unit provided a great setup for this model and was, as it's divided into 4 neighborhoods, very uniquely named A, B, C, and D. We really need to come up with some cutesy names for this. The goal of this model was to hopefully improve the continuity of care, strengthen nurse-family rapport, and reduce the burden of the primary nurse assignment for the nurses. And hopefully we can increase staff satisfaction and ownership over those neighborhoods. So our team of nurses sent out a baseline survey to see how much our team appreciated the primary model. Although not horrible numbers, with 65.4% saying that yes, they really did like the primary model, and 72.6% saying, yeah, we can build rapport with our families, we were still seeing a lot of significant complaints and concerns from families when we were rounding. So after implementing our neighborhood nursing model, after 12 months, we have seen a significant improvement in both of these numbers, with 89.3% of nurses reporting satisfaction with the neighborhood nursing model, which it just has been great for nurses. Our hallway is a little bit different than the children's at Anschutz. We don't have anybody behind us. All of our patients' rooms are on the outskirts. So your next teammate might be way down the hall. So they wouldn't even be able to develop really great nursing relationships, let alone these building rapport with parents. But we also saw an increase with the ability to build rapport with families, and this increased to 80.4%. This shows a strong improvement in staff satisfaction and a stronger sense of connection with the families, and an increased confidence in our new neighborhood model. So this is what we've seen so far with the impact of neighborhood nursing. While rounding, we have heard significantly less concerns about continuity. Families report excitement and comfort with seeing the familiar faces of their neighborhood. The neighborhood leaders and nurses have reported better communication with each other. And because of this improved consistency in assignments, this helps support trust and rapport with families, nurses, and nurse leaders. We are so excited about the impact of this project that has on the team, and we're seeing a more predictable relationship-centered care experience. And it's also helped support a satisfied nurse team. And the best part of this project, it created a sustainable model that has led to increased continuity for families and patients during such a vulnerable time.
I would love to.
Okay. As we transition to neighborhood nursing model, we also restructured our leadership rounding approach to better support both families and staff. So for context, in our NICU, we have about 230 team members that report to nursing. And to support such a large staff, we have 6 associate clinical managers, also known as ACMs. And previously, similar to the primary nursing model, each ACM was assigned to a specific family to follow them through their journey. And while well-intended, this often caused some people couldn't figure out which ACM to contact for their follow-up or for rounding. And then sometimes families really built a report with their assigned ACM and they only wanted to speak to that person. So if that person wasn't on shift, that could cause a delay in communication and support. So to address this, we shifted to a team-based model of rounding when each neighborhood now has a designated pair of ACMs. So it's typically one day shift paired with either a mid shift or a night shift. And so, for example, I'm Sheree and this is Kelsie, and we round in the D hall. We're Shelty. And so now it's created clarity in the unit, and everybody knows who to contact, which ACM team for each neighborhood. And so we aim to round several times a week, either together or individually, depending on our schedules. And we bring a little treat bag, and we stuff this treat bag with things that we know that our families like. Like we found that the gentlemen tend to like meat sticks. We had one family that really likes milk chocolate. Another one likes dark chocolate. We had one mom who didn't like candy at all, and she really liked popcorn. So we made sure to have a variety of popcorn for her. And so we go in and we talk, and we have an app called Rounds Plus that we have to document our leader rounding on. But instead of just hitting those structured questions, we really try to sit down and build a meaningful connection and ask about the siblings or any life events they have going on. And we try to touch base with them several times a week, if not daily. With this relationship building extends through their hospital stay, and we carry that rapport through discharge by writing personalized notes in the cards that we send families. For instance, our popcorn mom, she really liked our chats and our popcorn, so we signed hers Hugs and Popcorn, Sheree and Kelsie. And then we'll also put a little note in there if we know someone's celebrating something coming up. We'll be like, so and so, we're so happy that little baby being was able to join in your celebration. We're happy they're home. Our discharge cards are available in both English and Spanish and include QR codes for our Daisy nomination. They're about business card size. And we also put our Spread a Smile code, which is our children's recognition, in the discharge. And since that implementation, we've seen a noticeable increase in the family-driven staff recognition. Ultimately, this model has allowed us to move beyond task-based rounding to truly relational care, where families feel known, staff feel supported, and every interaction becomes an opportunity to create a lasting and meaningful impact for each family's NICU journey. And I'll turn it over to Victoria.
So this slide look like a EG to you, huh? So this slide actually shows how often families receive updates from their baby's care team over time, displayed by week. Our current goal is for families to receive at least one provider update each week, by 1 day a week. That's a goal, and for 90% or more of the times with the families. These updates come specifically from a neonatal nurse practitioner or a neonatologist. So along the bottom of the graph, you see the individual weeks, and along the side of is the percentage of families with a documented update. You can see all the lines. So the top one is really the 1 day a week line, and the rest is like 2 days, also 2 days, 3 days, up to 7 days a week, how often they have the communication with the family. So you can see that the 1 day is more, and that's what we're tracking. Overall, we see that most weeks are close to or meeting the 90% target. This tells us that regular communication with families is happening the majority of the time. You also see some dips during certain weeks. So sometimes the dips could mean maybe not communication, but it could be just a documentation deficiency because they have to document in the nursing flow sheet, which is not a usual provider workflow. So if they don't do that, they will not get the data. So we're going to dip. And also other times will be we have neonatal joining us. So maybe just knowledge so we can have some targeted education for them. And also we do week by week because we change the neo week by week so we know whom to contact in case we want to get better results. So moving forward, our focus really not only ensuring families receive regular updates, but also that these conversations are consistently and clearly documented every week.
So our last slide is just one of our patient family experience scores over a year. And as you can see, we were 100% recommended by most families. We did have a dip in a couple of months, and those could have been related to staffing or higher census. We know that our trends tend to go down when we have a lot of staff and a lot of census, just because there's a lot more people. But all in all, together with the neighborhood nursing, the leader rounding, the love notes, shine bright, and all about me posters transformed everyday care moments into meaningful human connections. These were nurse-led initiatives honored by families as true partners, celebrated by each baby's individuality, and ensured communication was compassionate, consistent, and personal. Achieving a 100% would recommend rating reflects more than just strong outcomes. It represents trust, connection, and dedication of the team committed to a caring, not just for infants, but for families who love them as well.
So as we look ahead, we want to build on the momentum of our current work and continue strengthening family communication through several key next steps. One important area of focus is rounding with a Spanish medical interpreter twice a week. This initiative is aimed at improving equity in communication for Spanish-speaking families by ensuring they receive timely information, have opportunities to ask questions, and feel fully included in care planning as part of the routine practice. We are also participating in the Captains of Inclusion Health Equity Project. This work helps us identify and address gaps in communication, access, and family engagement through a health equity lens and supports more intentional, inclusive practices across our unit. Another future direction is parent rounding using AI technology. This tool allows us to capture rounding conversations and complete documentation in real time, which frees the care team to focus more fully on the families, asking following questions, and supporting more meaningful, personalized discussions. Finally, we're exploring structured family check-in meetings. We learned about the importance of meeting with families early on during the last Define Forum, where early proactive conversations were highlighted as a key strategy for building trust, setting expectations, and aligning goals from the beginning of a hospitalization, particularly for families experiencing longer or more complex hospitalizations. Together, these next steps reflect our ongoing commitment to improving family communication, promoting equity, and ensuring families feel informed, supported, and truly partnered in their infant's care. Thank you.